Hello, everyone. What a great pleasure. Which one is doing the filming? All right, and that's where we're going to look. So I'm Richard Moss. I'm a doctor, a medical doctor, and I am an ENT head and neck cancer surgeon, and I live in Jasper, Indiana. I've been in practice for almost 30 years. It's a long time. And I am married. I have 4 children. I think we have some pictures of them: Ariel, Noah, Adina, and Isaiah, and my beloved wife. I grew up in the Bronx back in the old days, and I have run for Congress. I've opened up a bagel shop called the Bronx Bagel. Still exists, still lives on, I'm happy to say. And I also write columns. And I wrote a column on hydroxychloroquine, and it was published in the American Thinker, which I certainly appreciate. And I can mention that I am on Instagram and Facebook and Twitter at Richard Moss, M.D. And then we have a website as well that you can go to, richardmossmd.com. But it's this issue of HCQ, and let me just say I may shorten it so we don't have to repeat the whole thing each time. But it's hydroxychloroquine is our topic for today. And as I said, I may say HCQ, but this is a great drug. And how I came to know about hydroxychloroquine, HCQ, is because I took it. One of the things I did in my earlier career after I completed my training and my residency, I did a fellowship as well in plastic surgery, is I lived overseas. I did, you can say, volunteer work as a head and neck cancer surgeon in Asia, in 4 countries, including Thailand, Nepal, India, and Bangladesh. And as you may know, these areas, Southeast Asia, and South Asia in general, are rife with malaria. So I took HCQ for 2 years, and I eventually stopped. I was concerned about side effects, none of which I had. But I said, all right, look, as I wrote in my article, which I called Hydroxychloroquine, Me and the Great Divide, every drug has side effects, right down to Tylenol and aspirin. So I decided to take my chances with mosquitoes and Plasmodium, but I did take it for 2 years. And this is a wonderful drug. It's been around since the 50s. So we're going on 60, 70 years. Worldwide, there have been about 1 billion uses of this medicine. And each year in America, there's about 50 million prescriptions for this medicine. It was based off, it's sort of the synthetic version of chloroquine and much safer. And I'm not a big fan of the United Nations or the WHO, but just to say, the WHO considers it an essential medicine that everyone should have. It's one of 128 medicines. Some of the side effects, or one of the side effects, include the prolongation of the QT interval. And, we have in America mostly non-cardiologists, so just to let you know, that's part of the heart rhythm. And when that gets prolonged a little too much, you could conceivably cause cardiac arrhythmias. But having said that, taken alone, and again, 1 billion uses of this medicine, there have been no reported cases of cardiac arrhythmic deaths. So it's really a very safe medicine. It's worth mentioning that it's about 60 cents a pill. So we're talking about vaccinations and the incredible research and development of a vaccine, the money that will cost, the length of time before one is available. Most people actually don't get vaccinated, even the flu. We have about 50% use of the flu vaccine every year that we usually have. And it's not foolproof either. So, yeah, it's fine if, maybe it's useful to develop the vaccine. And I'm not discouraging that. But I wouldn't be holding our breath for that. And I want to mention that there's a better vaccine. We can call it God's vaccine. It's our natural immunity. Exposure to an antigen, as in the proteins that line the outer protein shell of the coronavirus, those little spikes, you may have seen the pictures of them. When that enters the body, we develop an immune reaction to that. And we may form antibodies. And there's another thing out there to say, it's turning out to be perhaps quite significant. T-cell mediated immunity. But not to lose everyone, it's part of our immune system. So I'll call that God's vaccine. Overall, I favor that one. I believe in our immune system. It's incredible. And it saves us every day, every one of us, other than those who are chronically sick or are immunocompromised, are protected by our immune system. And so it is with coronavirus. But in the meantime, it turns out there's this nice little drug. And it's been around for 50, 60 years and been used 1 billion times, maybe more. It's actually so safe and so important that in many countries it's over the counter. You don't need a doctor's prescription for it. You can just buy it. And it's dirt cheap. And that's our wondrous HCQ hydroxychloroquine. So I want you to understand that because this has become political, and as we all know, Donald Trump, our president, spoke about it. So obviously then, of course, the media attacked it. It's truly absurd, and they're very aggressive, and you have this bizarre situation where the medical boards of different states will threaten a physician who prescribes it, which is unheard of. This is an FDA approved medicine. And it's been used, a lot of it is empirical. Individual physicians confronted with patients at an early stage of the disease have found it useful at preventing the disease from progressing to a later stage where they may require intubation and to be on a ventilator. Those patients are in a lot of trouble. The key is to prevent that. And so you've got a pill that costs 60 cents a pill, a medicine, 60 cents a pill. And you can take 200 milligrams twice a day for 5 days, or if you want 10 days for a few bucks, with very, very minimal side effects. And again, I am speaking as someone who took it for 2 years. And many people have taken it for years and years. Let me just mention that HCQ is used for anti-malarial prophylaxis, but also it's used for patients with lupus and rheumatoid arthritis. So those are patients that are on it lifelong. And few or no side effects with patients who are using it their entire lives, because lupus and rheumatoid arthritis are chronic illnesses, and once you have it, you will need to be on that medicine probably the rest of your life. So we have incredible background on this drug. It's quite safe. And there are various cocktails, if you will, that have been devised or thought up by doctors in the field. And Dr. Zelenko is one, and there are many others that are using it, and usually in combination with zinc, because you really have to have the zinc in there, and Zithromax. Zithromax is a very safe, commonly used antibiotic, and there's maybe some legitimate concern that the two together, because both of them can perhaps be, in extremely rare cases, arrhythmogenic to influence the cardiac rhythm, and so there was concern. But by and large, extremely safe. And again, remember, very short-term dose. We're talking about maybe 5 days and maybe 10 days. So anyway, I thought I'd jump into the debate and speak about HCQ, hydroxychloroquine. Again, in a combination with zinc and Zithromax. The zinc, by the way, is important. The way it works, a little medical stuff here, but that's okay. It's thought that the HCQ affects the pH and enables the zinc to be taken into the cell, where it binds with the protein that is responsible for replicating the virus and inhibiting it. So the two really have to go together. And the Zithromax is felt to be useful for secondary bacterial infections. So you take all three, very inexpensive, zinc. HCQ, I said, is in America 60 cents a pill, compared to something like remdesivir, which is the new medicine they're talking about. Is that about $1,000 a shot? All right. I mean, you might consider the HCQ. It's a little bit cheaper, readily available, and been around for 60 years. Incredibly safe profile. And then you have zinc and the Z-Pak, Zithromax, readily available. So why is it that this has become so controversial? We know that the election is coming up, but even beyond that, the media and the Democrats, but I repeat myself, the Democrat Party media and the Democrat Party have been attacking this drug, and then the various states that may be deep blue states, but really red states too. I'm not too proud of the Republican Party either, just to say. A pox on both their houses, but between the two, I'd probably go with the Republicans. I hate to say it. I mean, what's going on in our cities and our streets, and I don't hear any Democrats condemning it. They seem to support it. That's truly a disgrace. The BLM movement, a disgrace. Just to say. But not to get distracted here, I'm talking about HCQ. So, first of all, obviously it's political. And before I go into the reasons why it's become so controversial, let me just say that, let me keep track of my time here. It is important also to understand that this cocktail, let us call it that, this combination, maybe that's better, is done with the Z-Pak, Zithromax, same thing, and the zinc. For the reasons that I mentioned, they work together best. The other thing that's important, it must be used early. And we're finding that when you use it early, it prevents it from advancing to proceeding, not the best word, to go into a more advanced state. So we want to get it early when they're just beginning to show some early symptoms. Whatever, a cough or a low-grade fever or something like that. You give it to them, to such patients, the HCQ, the zinc, and the Z-Pak, I call it Z-Pak, Zithromax. And virtually no cases of cardiac arrest or cardiogenic-based death. If you give it early, it seems to help. And so what is the concern about using it? Many clinicians are finding that it's working. And I have an article here by someone, his name is Stephen Hatfill, from August 4th of 2020. And, he's got excellent credentials, and, we don't have to get into all that, but well recommended. He is finding, in his review of various studies, they're finding that it is quite effective, and but again, the emphasis is on using it in ambulatory COVID patients. And then you can quarantine them at home, but they're not short of breath, don't require supplemental oxygen, so it's an early stage. So what's the harm with this? There really is no harm. And they're finding that it seems to help in preventing it from proceeding into a more advanced state where they're short of breath, they may require ventilation, to be on a ventilator. And when you're at that late stage of COVID disease, your chances, of course, go down. The key is to prevent that. So I would just recommend to all of you that you should not be afraid of HCQ and zinc. It's a mineral supplement. What's wrong with that? Okay, nothing is wrong with it. And then a Z-Pak, and very high safety profile. So when I wrote my article, and had it published on American Thinker, and received, of course, a lot of comments and so forth, which is good. I appreciate that. There's tremendous interest in that. And I think it helped that I had been on it for a couple of years, for what that's worth. But anyway, perhaps it lends a little legitimacy. But it was not political until Trump spoke about it. Then all of a sudden, and then when he said that he took it, which was in May, well, the gates of hell opened up at that point. And this otherwise harmless little molecule, as I write in my piece, became transformed into something else, a purveyor of doom, despair, and unspeakable carnage. And so this heretofore respected, commonly used, and highly effective medicinal suddenly became a major threat to life, a nefarious and wicked chemical that could alter critical heart rhythms, resulting in sudden cataclysmic death for unsuspecting innocents. And Trump, of course, not just irresponsible, as they said, he was evil incarnate for daring to even mention it. I mean, are we in a political season or what? That's an absurdity. Period. There's nothing nefarious about using that drug. Quite safe. So I should say that you have a higher risk of cardiac arrest from watching the Super Bowl. Just so you know. All right, so there we are. Other things have been suggested: vitamin D, vitamin C, elderberry, quercetin, but the big three seem to be the HCQ, zinc, and Zithromax. So, and then, I mean, we haven't even talked about the lockdowns and the economic catastrophe of these lockdowns. Just terrible. The worst self-inflicted wound I think we and the world have ever committed against itself, but particularly this nation. You don't quarantine healthy patients. Never been done. We've had other viruses, very deadly viruses, including, many of you may know, the Spanish flu in 1917, 1918. Not to mention a world war going on at the same time. No shutdowns. Because that allows you, I guess we get into other subjects, of why it's so political and, why the outrage. Whatever happened to the idea of it's between a doctor and their patient? I mean, it's an FDA approved drug, incredible safety profile. And now we have states that are banning the use of HCQ. Never happened before. Never happened before. So I want to say, hang on, I'll look at that. I gotta put my glass. I'll put that right here on. Some questions coming in, that's fine. I'll get to that in a minute. All right, let me just finish, and then maybe we'll have some time for some questions. Just in terms of why it's so political, I mean, obviously, the media, I think we've gotten the message. They don't seem to like Donald Trump. Has anyone gotten that message? I think I've gotten that message. The fake news? Okay, we all know. So they have an agenda, and the Democrats have an agenda, and there are no end of quizzling Republicans that, weaseling out as well. As I say, a pox on both their houses, because they really make me sick already. The unwillingness to do what is necessary, to allow a doctor to prescribe a medicine that's been around for so long and may benefit patients at an early stage in the disease. So, and then waiting around for a vaccine. Again, we're not recommending it for end-stage COVID disease. On a ventilator, no. It's probably not going to help. Nothing's going to help. The idea is to prevent it from progressing to that level. And here we do seem to find some benefit. The lockdowns, the masks, these are other things that we can get into, I suppose. State FDA approved medicine, pharmacy board threatening doctors for HCQ. Absurd, truly absurd. And so it's interesting to think of why it's so controversial. It really should not be, but it is obviously, and we mentioned the political reasons. There may, and then of course, the economic reasons. There's a lot of big, I'm usually not one, by the way, that attacks big pharma. But, do we have an incentive here to quash the HCQ rebellion by big pharmacy companies, because many of them are jockeying to get the big government contracts and to, produce a therapeutic like remdesivir or a vaccine, very, very expensive. So, you've got that side of it. But what's even worse is that you're finding maybe even medical researchers are being affected by this whole political debate and economic question, because many of them run these medical journals. And who are the advertisers in their journals, where they're often big pharmaceutical companies? So you have Lancet, producing reports and then having to retract them. That was more about the mask issue. And then, the whole issue about the inflated numbers, that somebody that was in a motor vehicle accident obviously died from that, but was COVID positive and listed as a COVID death, and those sorts of issues. So you have a lot of perverse incentives at work here, where you, at a certain point, you're not even sure if you can trust the medical research, because there may be politically, economically motivated incentives by even certain researchers. So we don't know as far as that goes, but I know Lancet came out with a big article about, I think it was masks and so forth, and they had to withdraw it because it was a deeply flawed study. So I would just say that we should be fine with HCQ and zinc and Zithromax at an early stage. I think it's fine. And I believe that it's okay to do it. And doctors should not be threatened by state medical licensing boards who are pursuing a political agenda, because they are, some of them, I take it, are so full of hatred for President Trump that anything they can do to make the disease look worse, or to prevent potentially very effective and inexpensive medicinals that have been out there for decades with a generally high safety profile, that's between the doctor and the patient. So that's enough about this. That is my that is my main statement here. So let's see. It's important to understand also, okay, just let's see, I think I have a few minutes here, touching on a few other subjects. What is it? We're finding that, let me skip on the masks. Masks are not effective. Even a big metadata analysis from the CDC itself, published in May of this year, said that the masks are not effective. Just so you know, they don't work. And there are different reasons. Even if you have the great N95 mask, you wear it. Number one, it gets moistened. It actually allows for the virus to be transmitted. Also, the little holes, the tiny pores get blocked by secretions and moisture. And so you're breathing around the mask anyway. It's got to be form-fitting. You touch it. You may take it off, put it back on. Forget the masks. Protect the vulnerable. Selective quarantining has always been the strategy. And in this case, it's the elderly, the infirm, and particularly those who are immunocompromised. You have chronic lung disease, chronic heart disease, obesity, hypertension, any of these risk factors. Sure, protect them. The lockdown should have been a nursing home lockdown, not the whole country, and not our schools. Kids, it's getting to a 0 mortality rate on this for COVID-19 for under 18. Forget about it. And here they're being kept out of education. And, we all have heard about the deaths of despair, the suicide, the depression, the drug overdoses, stress-related heart attacks, and then the damage being done to children now that, some of them are going back to school, but cases of, domestic abuse that are not reported. And let me just mention, the hospitals shutting down, locking down, all of the other, and only for, I think they call the non-elective procedures. I mean, we're not talking about facelifts. If you're doing a biopsy for a cancer, you're treating, chemotherapy or radiation, or somebody has, a heart attack or hypertension, or some other infectious disease, or stroke, they don't come in. And cancers are not being diagnosed or treated. I mentioned the deaths of despair and so many other conditions that are that go untreated, undiagnosed because people are so afraid. Hospitals, this thing about flattening the curve. All right. Try to remember the purpose of that was not to stop the spread of disease. A virus will virus. All right? You can quote me on that. A virus will virus. It's going to do its thing. It's going to spread. You protect the vulnerable populations, which I alluded to already. Selective quarantining. Quarantining the whole country. That is ridiculous. Keeping our kids out of school. That is ridiculous. Open up the schools. End the lockdown. Open up our economy. And you develop, just to say, and I may be closing here soon, just so you know, the whole idea of the lockdown was to prevent a surge or a spike in cases because of the fear of overwhelming our healthcare system. We never came near that. The hospitals were dying, not because they were overwhelmed, because they were underwhelmed. I mean, we have doctors and hospitals and family practice clinics out and about, out of business. The Mayo Clinic lost $1 billion during this lockdown. It's a lot of money. So the purpose of the lockdown, but it's always this moving goalposts. It was never to stop the spread of it. It was to prevent a surge or a spike in cases that would overwhelm the system. Never happened. Never came close. That's it. We're past that. The hospitals are, you remember the ship that went up to the USS Comfort, that went up to New York, went home after a week. Never used. The Jacob Javits Center, massive convention center, converted to a hospital in New York again. Shut down. They didn't need it. We've done enormous damage to ourselves. Let's stop the demagoguery about this. Let's open up the economy. Let the kids get back to school. And go ahead and order or use HCQ, zinc, and a Z-Pack, which I've been using for decades. And I used HCQ, I told you, for 2 years. My friends, remember one other thing, herd immunity. And just so you know, the coronavirus, they call it the novel coronavirus. We have had many other coronaviruses, and there is a cross immunity in a large percentage of the population. And so many people are protected already, and it's not necessarily through the B cells, which are the antibodies. You're not all doctors, all right, the B cells. It's through T cell mediated immunity, T cells, all right. I don't want to get too technical, but I'm just saying that many of us have cross immunity because of exposure to many other viruses that are in the corona family. The common cold is a corona virus, and obviously we all get that. So we have that cross reactivity, cross T cell mediated immunity. Many of us have that already. My friends, you have to let the virus plow through. As always, selective quarantining, protecting the vulnerable communities, basically nursing homes, and let everyone get back to their lives and take off those ridiculous diapers from your faces. All right, I got a question here, my friends, from Chasey Butters, Nugent. Is it more of an oxygen in the blood problem than a respiratory illness? Well, let us just say that it's a virus and it can affect the lungs, but at an early stage, it's fairly mild. Let me just 2 quick statistics and then we're going to close up here. The average age of this for the COVID deaths is 78, okay? Now, number one, they're much later in life, so, I mean, it's a tragedy for them to lose their lives, and Andrew Cuomo should not say a word, all right? That guy's got, now he's got blood on his hands, just so you know, all right? 11,000 nursing home deaths because he forced the nursing homes to take COVID-positive patients. And he somehow lauded as some kind of media hero. Just terrible. And we can get into it, but let's move along. This is an HCQ thing. But the selective quarantining, the infectious mortality rate is like 0.2. 0.2. 99.8 will survive this. And again, remember, the ones that are dying are mainly the elderly and those who have significant comorbidity. So yes, we agree, protect them. Selective quarantining has always been the recommendation. And we have any number of experts that will speak to that. Scott Atlas and John Geach and Ioannidis, David Katz and others from very prestigious places like Stanford and Newt Witkowski, I should mention, because I quote him in my article. Rockefeller University, virology, epidemiology, Yale, David Katz, Stanford, and so forth. Very reputable people from very prestigious. They have argued strongly against the carpet bombing style, as David Katz referred to it, of this total lockdown. No, that's not the way. All right, my friends. As far as oxygen and the blood problem, it's a respiratory illness, and that can affect oxygenation. Don't worry. You're not a doctor, so it's okay. So, when there's poor oxygen, it means it's a lung problem. So anyway, that was that question. My friends, I think I'll just leave you with this little comment. Go ahead and use your HCQ. Sweden is a great model. They did not do the lockdowns. Their death rate is the same as all of Europe, the European Union, and then way lower. The devastation to their economy is much, much lower. They have an intact economy, and they have already attained herd immunity. The Swedish model is what we should embrace. And getting back again to my main focus, yes, go ahead, use HCQ and the Z-Pak and the zinc. And I should mention that I'm not going to start prescribing, so don't start calling my office. I'm not prescribing it, but I'm going to tell you, I think this is a good community service. I'm going to mention it. there is something called, what is that? For emergency early out, advocate docs can prescribe. What is that? I wrote that down somewhere. Well, I'm sorry, I can't seem to find that. Can prescribe FDA approved. Well, there was a good website where you can do a telemedicine thing with the doctor, and he may prescribe it for you. I guess I'm going to have to tell you to Goldberg it, also known as Googling it. Anyway, we'll leave that alone. My friends, a great pleasure, and we're going to cut it off now. Appreciate your attention, and we'll be doing this on a weekly basis. Don't forget to check out Richard Moss, M.D. Facebook, Instagram, Twitter, and Parler. I'm on there too. Let's go to Parler. And check out my website, richardmossmd.com. Hey, look, can I give my books a little plug? By the way, here's my wonderful children, Ariel, Noah, Dean, and Isaiah, my beloved wife, and my beloved mother, who has departed, always an inspiration. If I can point out a couple books here that I've written that you may like, A Surgeon's Odyssey, written about my travels overseas. A lot of great adventures there, and then a book about growing up in the Bronx and about my mother. And we're focusing in on that now. Best travel book of the year, 2019. So you can take a look and go to my website. You can get the books on Amazon or richardmossmd.com. My friends, I'm going to sign off. I appreciate your attention. We'll see you probably on a weekly basis. Thank you very much.